We have a really good sense now with tens and tens of millions of doses of this vaccine having been administered. We have a really good sense of the safety profile of this vaccine in the 5 to 11-year-old age group. And I'm really confident in saying that it is a safe vaccine. The long-term data that we have is from slightly older children and from adults, but we have over 2 years of data at this point since the first trials were started, or we're coming up on 2 years now. And so we have a really good sense of that as well. And there's no evidence, there's no reason to think that something unexpected is lurking here in the shadows. On the other hand, I'm confident in saying that it's very effective. Over 90% efficacy in the original trial in the 5 to 11-year-old age group, which is roughly the same as what we saw in older children and in adults. And that was at a time when that trial was performed at a time when Delta was the predominant variant. The other side of that is, I guess, parents ask, well, my kid perhaps already had COVID, or I've seen other children with COVID and they weren't that sick, and they're not as scared of it for their children as they were for themselves, or certainly for their parents. It is absolutely true that COVID in children is not as terrifying a disease as it was for older unvaccinated adults. But that's not to say they can't get seriously sick. And I've had plenty of kids who either had, even if it was just 5 days at home with a really sore throat and a fever and a cough, and they didn't get admitted to the hospital, but they were sick that whole time and they didn't need to be, if we had the opportunity to vaccinate them, which I'm grateful we're going to soon. The jury is still out on exactly what the long-term complications of COVID are. It was initially noticed in London, in the UK, and it's since been replicated elsewhere, that in the period after a wave of COVID, the incidence, the rate of children developing type 1 diabetes is about twice what it would normally be. And interestingly, here in Bermuda, we've had a couple of new diagnosis type 1 diabetics after the last couple of waves. And it seems likely that perhaps this is an autoimmune response after having contracted COVID. So, there are small, low-level risks like that, and perhaps other unknowns after the illness.
We're hearing so many stories, about how this has impacted children so deeply and socially through their at-home schooling, the lack of activities, the lack of socializing. It's been so devastating to them.
I think we're starting to see some of the ramifications of that, and it'll be interesting to see how far it goes. But we closed, and I understand why we did it, but we had to close the schools and the sports teams and the clubs and the churches, and we didn't close the gangs. And so for a lot of children, the one social environment that persisted, that was available to them, was one that perhaps we would prefer they not have availed of.